How many of you feel completely overwhelmed by all the resources for the AMC exam? You see forum posts on Facebook, maybe on other different platforms, different information about conflicting book lists and online courses, and it's hard to know where to start. There are so many things out there, it's quite easy to get confused and not be able to start at all. If you're gearing up for the AMC Clinical, this video is for you, because picking the wrong preparation tools or misusing even the best ones is a top reason competent doctors stumble on exam day. And what if I told you that you only really need to focus on 5? So stick around to learn the one resource that most candidates overlook and why it can make or break your exam day. So let's start with the first resource. Exam recalls can feel like a shortcut, but relying on memorized scripts often backfires when cases are tweaked. Let's say that you memorized a chest pain scenario only to face something completely different in the exam. The real exam will always change details. A patient might be older, have a different history, or present in a way you didn't expect. If you just recite what you memorized, the examiner will notice and it won't be enough. That's why the real value of recalls is in showing you the pattern of topics that come up again and again. So use them to map out high frequency topics. Then practice frameworks rather than the scripts. Some people call it clusters. Whatever you call it, use the recalls so that you know what they're asking and how they're asking it. This way you learn how to approach any variation of a case. Once you have identified these topics, you need the right references to fill in the details. Now for targeted study, lean on to important references. The first one is Tax General Practice, and the second one is Connor's Clinical Examination. Now you don't need to read cover to cover. That just wastes month and details you won't need. Instead, treat them as a reference tools for when you need to clarify or deepen your understanding of a topic. Here is how you can use them efficiently. First, use your recall list to pick a topic. For example, let's say headache is one of the recurrent topics. You can check the relevant chapter and learn how an Australian GP would handle it. Then for practical exam skills, go to Tally O'Connor to review the examination steps for that scenario. Now, this way you can keep focused and relevant. You can also use Geeky Medics. Their videos are solid, but if you spot differences, stick to Tally O'Connor because these are the standard Australian guidelines. Now, recall patterns will help you to go towards the right chapters, and the books will give you the depth when you arrive there. Knowing the content is only part of the challenge because you need to now translate that knowledge into performance, and that's where my website learnmedicine.com turns your medical knowledge into exam-ready performance, station by station. Many doctors understand the facts but still struggle because the AMC exam tests a specific structure and process under strict time limits. So without a system for each type of station, let that be history or counseling or examination, it's easy to miss steps and run out of time or appear disorganized. For instance, our history station template walks you through 4 steps: opening, symptom exploration, red flags, and summary. The course is self-paced and designed to make these structures automatic, so you can approach each station with confidence and control. You can check the course link below to see a demo of our station templates in action. While a structured approach is essential, there is another factor that many candidates overlook, and it can make a real difference in how you're assessed, and that is the resource number 4. It's not a book. It's actually the list of official Australian guidelines that you might be skipping. These guidelines are essential for both exam and your future practice. Now, Australian guidelines are very much similar to the international guidelines, but there are some subtle differences which we have to know. For example, for Kawasaki disease, the therapeutic guidelines recommend low-dose aspirin, an important difference from some international protocols which recommend high-dose aspirin. While many guidelines align internationally, these subtle local tweaks matter in exam day, and that's why you have to make sure that you go through the local references as well. So the important references that you should go through are therapeutic guidelines, but you need a paid subscription for that. Community health pathway, if you can get username and password for that, I think that would work. Local hospital guidelines, as much as you can read them, especially from Royal Children's Hospitals guidelines and from Royal Women's Hospitals guidelines. And you don't need to memorize every detail. You can just bookmark these sites so you can quickly check them when in doubt. Showing you follow local standards is important to the examiners, and it helps you to avoid common mistakes in the exam as well. Now that you know the value of using the right guidelines, let's talk about another resource that can shape your preparation in a different way. And the final resource is your study group. Choose them wisely because the right peers can boost your confidence and skills. Unstructured groups can just spread misinformation and ramp up anxiety. So it is important to be selective. So try to do the mock stations and the group discussions as much as possible, but make sure that you do it with the right group of people. A good group should feel safe for making mistakes and open to honest feedback. You don't want someone to pep you up by saying good things about how you did in your practice. You want someone to be critical about your performance and tell you about your time management, about the mistakes you made, the questions that you did not ask, and so on. That's why I have created this Telegram group where you can meet people who are preparing for this exam. You can ask questions in this group, and I moderate this discussion. So there is no risk of learning something inaccurate or wasting your time on something that is not going to help you in the long term. So the important thing is passing the AMC is not about how many books you own or how much knowledge you have. It's actually about making sure that you do the right thing and you go through the right kind of resources. If you combine the recall patterns with the targeted reading from reference books, use a structured course to build your exam performance, and add local guidelines for student context, and work with a supportive study group to put your preparation into practice, I think that will be more than enough for you. This approach prepares you for any case you might face in the exam day. Now, if you need any help about your AMC preparation, or if you have any questions to ask, you can go to our Telegram group and start asking there. And if you want to check my course, you can go to the link that I've shared in the comment. All the best for your exam.